Hello, my name is New Lee. I'm doing an Ignite talk for LTech 3010s. Today I'm going to talk about a good way for pharmacy technicians to communicate in their workplace. What's a communication skill for pharmacy technicians? You should be an empathic, compassionate listener, and you must handle a lot of information with precision and accuracy. You should be friendly and interactive with patients. Avoid interruptions. Listening skill does not mean waiting for your turn to talk. You cannot focus on what somebody say if you are forming what you're going to say next, and speaker can read your face expressions. Focus fully on the speaker. You can listen in engaged way if you are constantly checking your phone. You need to stay focused on important non-verbal cues. If you find it hard to concentrate on some speaker, try repeating their words over in your head. Communications with concern, maintaining a friendly, approachable attitude, and providing all patients with an advice and guidance. Pharmacy technicians must be able to express medical terms in a way that their patients can understand. You all need to open display kindness. Empathy will help the patients feel comfortable. Nonverbal. Rolling your eyes or sighing loudly show impatience and disrespect to the customer. If your facial expressions is friendly, the patient will most likely respond in a positive manner. Demonstrate positive body language. Establishing a sense of trust with the patients. Asking them how they are doing upon each visit. Learning returning patient name and need to focus on maintaining a sense of honest in a combination with professionalism at all times. Keep communication simple. Being specific when providing messages or advice to patients. When the pharmacy technician uses short words or sentences, patient will recall more of what is said, and you must identify the most important message to deliver to the patients. Effective of questions. If technicians move through the questions or instructions too fast, the patients might become confused and misunderstanding. Never make the mistake of asking more than one question at the same time. Telephone equipped. Determine whether the task is within the scope as a technician or whether the call should be forwarded to a pharmacist. Make an offer for assistance and restate the purpose of the call before place the customer on hold or ending the conversations. Online communication. You will need to contact with doctor about prescriptions. Communicate with a pharmacist if they have questions about particular patient or prescriptions. Communicate with patients about their prescription history and enter information on the patient record. Adjust their tones. Always keep your feelings in check as communicate with patients. And if you feel frustrations or anger coming on, pause for a moment and take a deep breath. Wider team satisfaction is important. Communications between members of the healthcare team affect the quality of work relationships. When communications about the task and responsibilities are done well, it can improve in job satisfaction and it facilitates a culture of mutual support. Communication skill with hearing impaired patients. Add how they refer to communicate and notes in a computer. Always look at the patient when speaking and using a moderately voice. Prevent environment barrier. Environment barrier may include lack of quiet, private place to talk with patients, or lack of time to engage with discussion with patient. Reduce items on the counter so you can reduce the distractions. Communication with patients by email. A patient might ask a trust-related questions by email with a pharmacy technicians. They're likely to ask about particular medications. Question extend the a scope of knowledge of your technicians. You will forward the questions to a pharmacist for a correct answer. Patient satisfaction. Patient satisfaction increase when member of healthcare team talk the problem seriously, explain the information clearly, try to understand the patient experience. Empathy when talking with patients. Empathy process of communicating with patient, feeling of being understood, and demonstrate an understanding of patient's feeling for creating stressing relationships. Communications mistakes the pharmacy should avoid. Looking at your computer when talking. Not allow any time for questions. Asking only close questions. Patient barrier. Lack of awareness or feeling uncomfortable asking questions about their medications. Encourage patients to ask questions and take time to respond to questions in a thoughtful way. How the effective communication benefit. Ensure an effective exchange information is needed. The pharmacy technicians to appreciate patient needs. Improve patient trust in pharmacy counseling and education. Thank you for your time and helping Ignite Talk helpful to have an effective communication skill for pharmacy technician.